even though the main focus for MD-PhD interviews is more on the research, I think a lot of the advice I gave in my other video about preparing for your med school interviews will still hold. Like, still do the mock interviews, still prepare for the common questions that you might get in an MD interview. The tricky thing though about MD-PhD interviews is that you kind of have to do well on both ends of the spectrum. So you have to do well on your MD interviews, interact well with the clinical faculty, and know your why for going to medicine, but you also have to do well in talking about your research, what you did, the implications of your research, and potentially to someone who may not know that much about your research. Another difference is that there's a couple different more questions that you might want to prepare prior to going into your MD-PhD interview. So obviously you want to know your elevator pitch when they ask you, tell me about yourself. You want to know why you want to be a doctor. You also want to be able to answer questions about how you envision your future career. So like, for example, what type of research you want to do, what your clinical and research split is going to be. Another question that I frequently got asked is, how do you think you'll manage the challenges of such a long program? Or what do you think will be your greatest challenge in such a long program? And I think with this question, they're just trying to gauge, hey, like, this is a really big commitment. Like, are you actually ready for it? And with all of these questions, right, I don't really think there is a right answer. You just have to say something and justify it with your own experiences.